I am Dr. Mahesh Gopasetty, a transplant surgeon at Fortis Hospital, Bangalore Road, Bangalore. Today I will be talking about how do we prevent liver diseases. Liver is an organ which is located in the right upper part of the abdomen. It weighs roughly about 1.5 to 2 kilos in an adult. And it has more than 500 functions, and it's a very silent worker. What we have is about 70% in excess of liver. That means until more than 70% of the liver is damaged, person will not even know that he has liver disease, and symptoms will not appear. So that's why most of the time, by the time we identify liver disease, more than 70% of your liver is already damaged. Common causes for liver damage are infections like hepatitis A, B, C, and hepatitis E. And nowadays it is common to have a disease called as non-alcoholic steatohepatitis or NASH, or it is also called as NAFLD. These patients are typically obese, and they may also have diabetes. And this is coming up in a big way. That is this disease called NASH. And the third most common cause for liver damage is alcohol intake. So let's start talking about infections, hepatitis A, B, C, and E. How do we prevent these, and what to do if you have hepatitis B, one of these infections? Hepatitis A and hepatitis E are preventable by vaccination, and they are spread by contamination through the water or vegetables. So one has to wash their hands and veggies clean before consuming them raw, or before eating with your hands. These patients with hepatitis A and E, they typically start to have fever, and they suddenly notice that they are weak and they develop jaundice. People with hepatitis A and E typically recover fully once the infection is under control, and it does not continue to damage liver and lead to chronic liver disease. Hepatitis A and E are preventable by vaccination. Hepatitis B and C are spread through the blood and body fluids. Who should get tested for hepatitis B? These are the people who work in healthcare industry or who are exposed to blood and body fluids. People who have received blood transfusion before 1992. Before that, we did not even know that there existed this hepatitis B and C, and the blood in the blood bank was never tested for them prior to that. And people who have multiple sexual partners, who share needles for drug use, or if any member of the family has hepatitis B, or if your spouse or partner has hepatitis B or C, or if you're born to a parent who has either hepatitis B and C, these people need to get themselves tested for this disease. Hepatitis B has a vaccination, and if you don't have hepatitis B, you can get yourself vaccinated and prevent this disease from infecting your liver. Once you get affected with hepatitis B, you can have a little slight amount of illness to start with, and that may disappear completely. You may think that you have recovered, but this hepatitis B continues to damage your liver, and when the patient develops end-stage liver disease, that's when you realize you actually have this hepatitis. And these patients, by the time they may come up with any signs of liver failure, like swelling in the leg, fluid accumulation in the abdomen, feeling weak, developing jaundice, or even sometimes vomiting blood or passing blood in stools. Hepatitis B, like I said, is preventable, and you can vaccinate yourself. Hepatitis C, we don't have a vaccine, but the good news is that we have very good effective treatment available for hepatitis C, and we can cure hepatitis C with the latest available medications. Let's move on to this lifestyle disease, which is called as non-alcoholic steatohepatitis. And who are the people who develop this fatty liver or NASH? Most common cause for NASH is alcohol intake. People who consume alcohol on a regular basis tend to develop fatty livers, And if you consume alcohol and you have a fatty liver, you better stop taking alcohol immediately. If you continue to take alcohol, this can ultimately lead to chronic liver disease and liver failure. People who have diabetes or who take chronic medications, who are obese, these are the people who have a common tendency to develop NASH. How do we prevent this NASH? If you are a chronic alcoholic, you better stop taking alcohol. If you know that you have some kind of liver disease which is ongoing and you take alcohol, the injury gets compounded. And if you stop taking alcohol, at least you can slow down the process and prevent yourself from getting into this liver failure stage. If you have diabetes, you control your diabetes. That again helps. If you're obese, if your BMI is more than 23 for that matter, for us Indians, you have to get into some kind of lifestyle and help yourself in order to and reduce your weight. Medications work only in conjunction with weight reduction, and taking medications and not reducing your weight typically does not help you with your NASH or fatty liver. We already spoke in another video about alcohol intake and the effects of alcohol intake. I'll just touch upon it very briefly. So there is nothing called as a safe alcohol intake. If you really have to take alcohol, you take it with responsibility. If you have fatty liver or you have any other underlying liver disease, you should not be taking alcohol. And if you really want to take alcohol, make sure that you don't take it on empty stomach. You don't drink alone. And for some reason, if you really have to take alcohol on a regular basis, make sure you refrain or abstain from taking alcohol 6 consecutive weeks every year. This is to help you prove to yourself that you are not addicted to alcohol and you are not dependent on it.